Afternoon, everyone. Can I have a thumbs up from Joe if you can hear me, just to check it's all right, because I can see you, Joe. Yeah, thumbs up, right. Lovely. I can just see the numbers rising really quickly, so I'll just give people one more minute just to make sure that they are in the room. For those of you joining, we are just about to start. When the numbers settle, I will get going. All right, it's 2 minutes past. I think we'll get going. So a big welcome to everyone this afternoon for our event as part of Clinical Audit Awareness Week 2024. We're really pleased to welcome you and really pleased to tell you something about the about NATCAN, the National Audit Collaborating Centre, National Cancer Audit Collaborating Centre. So my name is Caroline Rogers. I'm one of the associate directors at HQIP, and we HQIP commission the centre on behalf of the funders, who are NHS England and NHS Wales. So the bulk of the work this afternoon will be done by the NATCAN Centre, so I will introduce. So a little bit of housekeeping. We are recording the session and it will be available afterwards. We have turned the chat off because there are so many people. We thought it might be pretty difficult to follow and respond. We have turned the Q&A functionality on. So if you have a question for the presenters, if you type it in the Q&A, we'll have hopefully a really decent amount of time at the end to respond to any questions. That's probably all I need to say. We want to have a good focus on the presentations and then, as I say, come to the questions at the end. So firstly, we did something a little bit different. HQIP did something a little bit different when we commissioned this centre. We didn't specify each individual audit in the detail that we normally do. We specified that we'd like organisations or an organisations to step forward and run the centre as a whole and host all of the cancer audits. So this is great timing to be talking about this because the centre's been established for nearly 2 years, or it will be 2 years in October. So all the setting up has been done and the work has really started with some speed now. Outputs have started to be produced. And in September of this year, we anticipate that the first, for the new audits, the first State of the Nation reports and accompanying data will all be published. And obviously there are existing audits and their publications continue. We'll say, I know there'll be a little bit of information about that in a minute. So in the past 2 years, the centre has been established and the existing cancer audits have also been incorporated into the centre. So now all the cancer audits, or all the national clinical audits for cancer, I should say, are hosted by the centre. So this is a chance for us to really hear from the centre how it's going to work, how people can use the data, what it looks like, and ask questions. Joe, I know, is going to talk about this a little bit at the moment, but obviously when we commissioned this, we really wanted to have a focus on building that centre of expertise, amalgamating all those resources, and bringing people together so that the audits could learn from each other and work together. And the centre are really achieving that with the work that they're doing. So they will speak a little bit more about that in a minute. So as I say, we entered into an open tendering process, and the RCS, the Royal College of Surgeons, stepped forward, and they won this process and are now fully established as the host for this centre. So that's a little bit of the background. I'm going to hand over to Joe, who's going to tell us a bit more about the work and give us some demonstrations. So over to you, Joe.
Thanks, Caroline. I'll just share my screen. Okay, so I'm Joe Badur and I'm a senior project manager at NATCAN, and I manage the National Lung Cancer Audit and the National Ovarian Cancer Audit. As Caroline mentioned, NATCAN was commissioned by HQIP and is funded by NHS England and the Welsh Government initially for a period of 3 years. So NATCAN's aims are to provide regular, timely evidence to cancer services of variations in England and Wales, to support NHS services to identify reasons for the variation in care and to help guide quality improvement initiatives, and also to stimulate improvements in cancer detection, treatment, and outcomes for patients, including survival rates. So NATCAN, as well as Caroline's also mentioned this too, is the home of the 10 national cancer audits in England and Wales. And you can see there a picture of the Royal College of Surgeons. So we're based at the Clinical Effectiveness Unit at the Royal College of Surgeons, and we in collaboration with the London School of Hygiene and Tropical Medicine. So there are 6 new cancer audits, which started in October 2022. These are kidney cancer, non-Hodgkin lymphoma, ovarian cancer, pancreatic cancer, and 2 separate audits in primary and metastatic breast cancer. And then there were 4 established cancer audits, which moved into NATCAN in 2023. These are esophagogastric, bowel, prostate, and lung cancer. So NATCAN aims to maintain key features of the existing cancer audits. So these are close clinical methodological collaboration, close links with all stakeholder groups, for example, clinical professional bodies, NHS commissioners, regulators such as the CQC, and patients, charities, and the public. And keeping audit delivery and quality improvement informed by research and development. Each of our audit teams have methodologists as part of the team and experts in clinical epidemiology and health services research. So what are the new things that NATCAN will be doing? What are the innovations? So we are using a single resource of linked data sets for all the cancer audits. So this is using rapid cancer registration data as well as gold standard registration data. The rapid cancer registration data is something that started up in the COVID pandemic. It was a way of processing the data quicker and getting that data over to us quicker. This then provides more frequent, this then helps us to provide more frequent and more timely reporting. And this is how the quarterly reporting started that we'll talk more about later on. So but on a sort of simple level, the quarterly reports provide data to trusts with trust level results, which the trusts can then use each quarter to monitor how they are doing with new data each time. We also have our State of the Nation reports, which are around 10 pages long, so shorter than previous annual reports, and they include 5 recommendations at a national level. And there will be a greater focus on quality improvement and aiming to close the audit cycle, so helping trusts and health boards to implement the changes that we're recommending. So this slide lists the various data sets that we use in England and Wales. The ones in green on the English side there are data sets that we get from National Disease Registration Service, and the ones in orange are from what's called the Leeds production team. For Wales, the ones in blue are the data sets we're currently receiving. The purple cancer registration data with the question mark, that's something that we're hoping to receive in the next year or so. The system in Wales will be changing the way they're processing the data. So we're having to wait for these new systems to come in place. And for the quarterly reporting, for example, we are unable to do that for Wales at the moment, but we hope to be able to do that from 2027, I believe. So some more information on our audit reporting. As I mentioned, our quarterly reporting is something that's really important and will be supporting quality improvement. We've got here a timeline of the various reports published by all the NATCAN that will be published or have been published by all the NATCAN audits in 2024. So the lung audit actually started doing its quarterly reporting in July 2023. But you can see there it will be reporting on metrics or performance indicators every quarter of this year. And the lung audit actually introduced an interactive online data dashboard this year in April, which Ella will be talking you through later on in the presentation. The prostate audit published its first quarterly report in February and the second one in May of this year. That was for data quality indicators only, and they'll be publishing their first quarterly report using performance indicators in August. And esophagogastric and bowel will be publishing their first data quality indicator reports in July and October, with their first quarterly report featuring performance indicators in January of next year. And then the 6 new cancer audits all published their first quarterly report in April of this year, which was data quality indicators only for now, with the second one of those coming next month in July, and the first quarterly reports with performance indicators in October. So moving on to annual reporting, as mentioned, we'll have our annual State of the Nation reports. So just a breakdown here again of timings for each of the audits. So the esophagogastric and prostate audits published their first State of the Nation reports in January of this year. The bowel audit published its first report in February. The lung cancer audit actually published its second State of the Nation report in April this year. We were the lung audit were the first ones to publish State of the Nation in 2023. And then the 6 new audits, as Caroline mentioned, will be publishing first State of the Nation reports in September this year. So just to highlight here how NATCAN will be stimulating improvement of cancer services. At a NATCAN level, there is a NATCAN quality improvement team, which is coordinated by our clinical director, Ajay Agarwal, and this is supported by clinical fellows. Each of the audit teams has recruited a clinical fellow. We have an academic partnership with the University of Leeds, and we'll be focusing on QI activities that are flexible and responsive and based on experience that we already have from the existing cancer audits in the clinical effectiveness unit. And we'll also be ensuring these are closely aligned with existing national initiatives for QI, such as the National Clinical Audit Benchmarking, Care Quality Commission, and Getting It Right First Time. At an audit level, and following on from publication of our reports, we will be putting together or helping support local action plans. One of the documents that was sort of is supplementary material for State of the Nation report will be a local action plan template, which will be something that trusts can use or health boards can use to put together a plan to make improvements at their organisation once they've read the recommendations in the report. We'll also have QI tools, other QI tools for local teams to identify good practice and areas of weakness. We'll have a national programme of QI workshops and webinars. The lung audit and ovarian audit very recently both ran webinars in collaboration with the professional societies, which were very well received in April and May. And we'll have our social media profile using a range of channels. And in terms of innovation, just to mention again, we'll be aiming to close the audit cycle. Everything will be fully embedded into a wider NATCAN QI strategy. And importantly, each cancer audit will be designing and implementing its own QI initiative in the first couple of years following on from publication of our first State of the Nation reports. So this slide shows the NATCAN quality improvement event we held at the Royal College of Surgeons in March. So some pictures here of all the different teams, all the different the 10 different audit teams were all represented with clinical leads attending. NHS England were there and also HQIP, and we also had some representatives from our patient and public involvement forums, which was great. Here we've just got the themes of the event. These were NATCAN's approach to supporting and targeting QI, identifying interventions for quality improvement, what works and what doesn't, outcome reporting and the role of positive outliers in driving QI, and how to design and implement QI initiatives, the clinical reality. A couple of slides here on communications. We've got a website up and running. This is for now just an interim website, just so we've got a presence online. Over the next year or so, we'll be putting more work into developing a new website. At the moment, the new audits have their own web pages on the website when you go into audits at the top of the menu. But the previously existing audits still have their own websites at the moment, but the NATCAN website links into those if you choose that audit on the page. And on the website, rather, an example here is the BAL audit website. Also important to mention patients and public. So all the new audits have set up over the past year or so patient and public involvement forums with help from the relevant charities. So it's really important for us to have clarity of messaging for people living with cancer. And we'll be disseminating the results from our reporting, from our State of the Nation reports, and also our quality reporting to the forums. And the members of the forum will be helping to shape our improvement priorities. We've just got an example there of some videos that are on our website for the pancreatic audit. We've got Pancreatic Cancer UK talking there, and also one of the members from the Pancreatic PPI Forum. So just to sum up then, really, in terms of next steps for the remainder of 2024, we've been developing our healthcare improvement plans. So those will hopefully imminently be published on the NATCAN website. These provide more detail about our performance indicators. As mentioned, we've got our quarterly indicator reporting. So for the new audits, these will be data quality metrics to begin with, also for our next report in July. And then performance indicator reporting from October 2024. State of the Nation reports, including 5 recommendations. And for the new audits, these will be published in September. These have already been submitted to HQIP for approval and also to NHS England. And as mentioned, we'll have a greater focus on quality improvements, aiming to close the audit cycle. And each audit will be designing and implementing a QI initiative. That's my last slide. So thank you. So I will hand straight over to Amanda, who's going to talk more about quarterly reporting for the new audits.
Great. Thank you, Jo. So hi, my name's Amanda McDonald, and I'm a data scientist on 2 of the national audits, on the esophagogastric audit and one of the new audits, the pancreatic cancer audit. So what I'm going to do today is give an overview of an example of the quarterly reports for the new indicators that were released in April. And I'll walk through our interactive report in a moment. Just to note, as you can see on the screen, all of the reports are published to our audit web pages on the NATCAN website. And here's the example for NPACA, which is the acronym for the National Pancreatic Cancer Audit. Before going into an interactive walkthrough of the report, we just wanted to highlight why we've chosen to focus on data quality indicators for these first 2 quarterly reports for the new audits. Firstly, without complete data, it's challenging to calculate our performance metrics and also to adequately risk adjust to make sure we take into account the different case mixes at different providers in England. Also, all of the quarterly reports, all of the audits are using the rapid data, as Jo mentioned, for the quarterly reports. The benefit of this is that it is available with at most a 6-month lag. So it's more real time than using the gold standard data, which means in the future we'll be able to track data quality and indicators in more real time than in the past. However, the speed of production means it's undergone less curation and data enhancement by NDRS. So all the more reason to highlight data quality. And just as a note as well, the rapid cancer registration data, this is curated by NDRS based on the monthly cause D submissions at the trust level. And then also, these reports hopefully start to raise awareness with the trusts about the new audits, and highlight where the specific variables that we're interested in for the audit and where there's areas for improvement in the data quality submitted. Okay, so I'm just going to exit this screen and bring up the data quality dashboard. So just to orient you to these, right now they are Excel-based reports that, as I said, you can download from each audit's website. As an orientation, each one has an introductory tab, which has information like how the audit cohort was defined, the data sources that were used, so helps with the context. And also an explanations tab that has finer detail on, for instance, how diagnoses were allocated to trusts, and also further resources on data quality. So there are two tabs with results at a trust level. One is so the data quality dashboard, which is the heart of this, which has two drop-down menus. Firstly, one where a trust can be selected, and secondly, a drop-down menu of variables that will then show the completeness of that variable at that trust. On the right-hand side, there's information on how the completeness was calculated, the numerator, denominator, the data source, the name of the variable that was used, and a target completeness. So for most cases, we've set target completeness at 90%. And then what you can see is the results for the trust in table 1. So the number of diagnoses over the 12-month period, proportion complete, how that ranks nationally among trusts. You can see the completeness for the Cancer Alliance that trust belongs to, and the national result. And then to the right-hand side, you can see this visually showing where the specific trust ranks amongst all the trusts providing, in this case, pancreatic cancer services relative to the 90% target. And at the bottom, there's the other trusts as well presented for context that are within the same alliance. So the variables that we've selected, they vary a little bit between audits based on their focus. For pancreatic cancer, we've selected the variables that had less than 100% completeness in the rapid cancer data. It's about 20 variables in rapid cancer data, and it's in general well completed. Key variables like gender, age, index of multiple deprivation, diagnosis, date, tumor site were all 100% complete. And so what we have reported on here were those with less than 100% completeness, which includes basis of diagnosis, ethnicity, morphology, performance status, route to diagnosis, and stage at diagnosis. Of course, performance status and stage are variables that we tend to be very interested in, both as stage at diagnosis can be a useful performance indicator, but also these are used to risk adjust results between trusts. So if we click on stage at diagnosis, we can see that overall at a national level, this is to date not as well completed as some of the other variables in the rapid cancer registration data. And there's quite a lot of variation between trusts in the visual on the right here in terms of completeness. There's also a short patient characteristics tab, which gives just some information on the patient population that's been included. A simple breakdown of sex, age, and index of multiple deprivation at the trust, within the Cancer Alliance, and at the national level. So what we hope to achieve with these dashboards is that Firstly, that trusts review them, get in touch if they have any feedback or queries, and also that it can help to start raising awareness about the audit and start discussions around data completeness and quality. So we'd really like to hear from you on any feedback and if you found these as useful tools. That's largely the overview of this first quarterly report. This one was published in April. We're publishing another one in July, which will cover all diagnoses in 2023, which will be the most recent data that we have. These reports are stored on the NATCAN website under each of the audits. And I think after this meeting, colleagues at HQIP will send around further links to make sure you have access to those. So I'm going to hand over to my colleague Ella, who's going to take us through, let's say, the next iteration of the dashboards using the example of the existing lung cancer audit.
Thanks, Amanda. I'll just share my screen. So hopefully you're able to see that first slide. Yeah, great. So my name's Ella and I'm a data scientist that works within NATCAN. I work across 2 audits. So the new audit I work across is the non-Hodgkin's lymphoma audit. And then the established audit that I'm on is the lung cancer audit. And I'm going to be talking about the future directions of quarterly reporting. And that's based on my experience of working on the National Lung Cancer Audit. So as I said, just for a bit of context, the lung cancer audit is one of the established audits that joined NATCAN last year. Our first quarterly report was published in July 2023, and this was implemented as a standalone Excel file. When we started quarterly reporting, we aimed to keep it relatively simple and intuitive to use, with a focus on showing trends over time. We took an iterative approach to developing our quarterly reports, whereby we really encourage people to use them and feedback to us, like what works, what they would like to see. And then we took that user feedback and sort of comments to guide changes that we made in the next quarterly report. And that's something we are continuing to do. So, really do go have a look. We really welcome your feedback because it does help shape these products going forwards. As of April this year, we've actually transitioned to online interactive dashboards, and that's something I'll walk through a demonstration a bit later. So in terms of the content of the quarterly reports for the lung cancer audit, our indicators were selected from those we include in our State of the Nation report, which is published annually. So we chose our indicators on advice from our clinical leads, and we gave consideration to indicators that have the possibility to show short-term changes. The analysis presented in our quarterly reports is based on the rapid cancer registration data, and we present 3 years of data at quarterly time increments. So the latest quarterly report that we published in April shows data up to the end of June 2023. One point that's important to note is we've noticed the completeness of data for chemotherapy and radiotherapy lags behind some of the other data sets that we've used. So we've actually, for indicators that rely on those data sets, we don't publish the most recent quarter. So that's just something to be aware of when you are taking a look. So as I mentioned, in April of this year, we transitioned to publishing the lung cancer audit dashboards in an online format. So these are now viewed in a web browser as a Shiny application. And this is also the first time we've published our State of the Nation report alongside our quarterly reports, together. So this first iteration of sort of publishing online dashboards, we include 3 dashboards, which all present results at NHS trust level. So we continue to include a data quality dashboard alongside our quarterly reporting dashboard. And then the third one we include is a dashboard that sits alongside our State of the Nation report. The design of these follows past quarterly reports that were developed in Excel, and also a data viewer that we published alongside our last year's State of the Nation report. As I mentioned, we continue to make iterative improvements to these dashboards. So that could be additional functionality and content. And we do have, we are continuing to evolve that. We have another publication coming up in July that sort of will have evolved. So I've just put the link here of where the dashboards can be accessed. I think HQIP have kindly offered to share that, as a resource after the meeting. So, please do go and have a look. We welcome your feedback. So this slide just shows you how to access our dashboard. So the Lung Cancer Audit has recently redeveloped their website. So the screenshot in the top left is of the homepage, and you'll see at the top there's a data and statistics tab. If you click on that, you should then be presented with a button where you can access the dashboards, and then clicking on that then launches the dashboards in a separate browser tab. And that's what the screenshot in the bottom right is showing. It's showing sort of a screenshot of the quarterly reporting dashboard. So at this point, I'd just like to provide a demonstration, I guess, of some of the features of our dashboard and run you through the contents. So once you, from our webpage, once you navigate to the dashboards, you'll land on this homepage here. So at the top, there's an introduction to the audit and an outline of the data sets that we use. Below that, there's an overview of the 3 dashboards, and I just wanted to take some time to walk you through that. So what we do is we've set out the intended audience and the aim of each alongside the data source used and the time period. So for the data quality dashboard, our intended audience is NHS provider teams in England. And the aim of this dashboard is to shine a spotlight on areas where improvements in data completeness are needed. This is based on the rapid cancer registration dataset, and at the moment, the time period that spans aligns with that of the State of the Nation report. That's because the first time, this was published, it was published alongside our State of the Nation, so it hopefully provides, some sort of data quality context for that report. The second dashboard we include is the quarterly reporting dashboard. And again, the intended audience for that is NHS provider teams in England. The aim of this dashboard is to present performance indicators responsive to changes over time and to support NHS providers to track their progress and monitor quality improvement. Again, this uses rapid cancer registration data and runs up until the end of June. The time period runs up until the end of June last year. Both of those dashboards, so the data quality dashboard and the quarterly reporting dashboard, we aim to update those on a quarterly basis, whereas the State of the Nation dashboard, as I mentioned, that report is only published annually, and so this dashboard will be updated the next time we sort of release our next State of the Nation report. So the intended audience for the State of the Nation dashboard is a bit broader. It includes NHS England, integrated care boards, cancer alliances, as well as trusts within England. And the aim is to provide a national picture and highlight regional variation in the patterns of lung cancer across England. So if we just have a look at this black panel on the left-hand side here, this is our navigation panel. So if you expand this dashboards tab here, you'll see the 3 dashboards listed. Each of the 3 dashboards is laid out in a similar way. So I'll probably talk you through the layout of the quarterly report, but then hopefully once you understand how to navigate around that, as I said, the layout in the data quality and the State of the Nation dashboards is very similar. So, hopefully then you can find your way around. So for the quarterly reporting dashboards at the top here, we have an overview, which again just sets out the intended audience, the aims, the data source, and the time period for this dashboard. Below that, you have a box with 2 user-selected inputs. So the first allows the user to select their NHS trust of interest, and the second below that allows them to select their indicator of interest. Below that is where we show the results and have a bit of information about the indicators and methods. So there are 4 tabs along the top here that you can see. So the first is where we present the time series plot. So as I mentioned, we present 3 years of data at quarterly increments. So the horizontal axis is time, and then the vertical axis is the proportion. So all the indicators that we include in this dashboard are proportions. So that sort of vertical axis will be the percent. One feature is that if you're wanting a bit more information about a certain data point, you can hover, and then up pops this information box that just provides a bit more detail, perhaps the specific value of that data point if you struggle to read it like off the axes. That was kind of a feature I think we got from our sort of project team and sort of the wider community that would be useful. The legend over here is interactive. So perhaps if you wanted to look at the moving average, which provides a slightly more smooth trend over time and not the kind of raw proportions, you can click on the click on the proportions, and that will remove it from the figure. And you can do that with, you know, sort of every data entry in the legend over here. That's interactive. In the bottom right here, we do actually provide a date stamp. So I think a request that we got from, you know, trust teams, if they really want to be able to download a copy of these figures and sort of their data in sort of tabular format. So for the figure, if you have a look up here in the top right corner, there's a series of thumbnails. The little camera button, if you hover over that, that allows you to download a copy of this figure as a PNG format. And as I mentioned, there's a date stamp provided on that. So you just have a point of reference as to, I guess, the time period that figure covers. Moving on to the data table. So this contains, I guess, the data that's used to create the figure, that time series figure, but just in tabular format instead of a figure. And then there's ability to download that here. So that will download this information in a CSV format. There are two information tabs. So the first one contains information about the indicator. So you'll see here, again, we've got the definition of the numerator and denominator used to calculate the indicator, as well as details of any risk adjustment and if a target is applicable. It also sets out the data source used and the time period covered, as well as the update, the frequency that this indicator will be updated. Finally, there's a methods information tab. So on the time series plot, there's a series of kind of statistics. I guess you've got the raw proportions and the moving average. So it just sets out some information about how those are calculated, as well as a bit of information on missing data and how patients are allocated to NHS organisations. At this point, it's important, or sort of I'll signpost you to a methodology supplement that we publish alongside our State of the Nation report. So if you want more information about the indicators, that will be a good resource to refer to, and that's available on our website. I think that was everything for quarterly reporting. I can briefly show you the data quality dashboard. So again, at the top, you have an overview setting out the intended audience, aims, data source, and time period. The format is very similar to what Amanda presented for the new audits. So what we have here is so again, you have the two user selected inputs where the user can select their trust and data completeness metric of interest. The figure that we present is slightly different. So it's a ranked bar chart. So again, on the horizontal axis, you have the rank of the trust nationally, and then sort of proportion complete on the vertical axis. Again, here you can hover over certain data points if you're wanting to find out perhaps, you know, which trust has the highest level of completeness nationally. You can hover over and it shows you there sort of, East Lancashire, you know, for data completeness with basic diagnosis, East Lancashire is ranked first. And then similarly down here, for the entire data series, you can sort of hover over points and see that. And again, the legend here is interactive. So perhaps, you know, this horizontal line here represents the target. If perhaps you wanted a copy of the figure without that showing, you can just remove it from the legend here. One thing perhaps to show you so similarly, you've got a data table which shows the information in that bar plot, but it's in tabular format. One thing to mention with these tables is they are interactive. So perhaps if you wanted the information in this table to be sorted by rank, there are two little arrows next to the rank here, so that will sort the data from highest to lowest rank. Similarly, if you wanted to sort trusts alphabetically, there's again toggles here that allow you to sort the data by trust alphabetically. Also, there's this search bar here, so perhaps if you wanted to look up, you know, a specific trust, say Barts, again, that will just return you one row for Barts and sort of gives you that information there. So I think that's perhaps a functionality that's will be more useful for kind of some features we're releasing in the future. So I think that's everything with data quality. In terms of State of the Nation dashboard, very similarly, you have an overview at the top that lays out the intended audience, the aims, the data source and time period. Again, with two user selected inputs, so the user can select their trust of interest and their indicator of interest. And for this here, we present a funnel plot. So the horizontal axis is the trust volume. So that's the number of patients that a trust sees. And then the vertical axis here is the proportion. Again, this is interactive. One feature I did want to show you. So I think Sometimes you can get a cluster of trusts where it can be a little bit tricky to kind of, differentiate one from the next. So there is actually a feature that allows you to zoom in on a specific cluster of trusts. So if you just drag over a cluster like that, it allows you to zoom in on the plot. And then perhaps you can just a bit more clearly hover over those points to work out, which trusts are clustered together. And once you've done that, if you want to return to the full picture original figure, again, you just go to the thumbnails in the top right up here. There's a little home button that allows you to reset the axes. And again, that takes you back to the full figure. So in case that's useful for people. So if we go back to the navigation panel on the left here, there are a few other tabs I just wanted to show you. So there's a contact us tab. As I mentioned before, these dashboards are, subject to ongoing iterative development, and we really do welcome suggestions and feedback. And so here we just, if you do have comments to share, there's an email address here. If you could just submit them using that, that would be fantastic. Next, there's an updates tab. So as I mentioned, some of these dashboards are updated on a quarterly basis. The first one, this details in this version log so far are just for the version we released in April 2024. We have another update coming out in July. And so any changes we make to, I guess, the time periods, the data spans, any additional functionality that we're adding, they will be added to the update log here, so that perhaps if you've downloaded a figure from a previous iteration, you'll be able to go back and see, I guess, a summary of sort of changes that are relevant to that release. And finally, there's an acknowledgements tab. So this is really just to say this has been a team effort over the last year and a half to get the dashboard, the quarterly reports to this point. And so this tab just sets out members of our project team that have contributed to developing the quarterly reports and dashboards, and also the professional societies and bodies that we're associated with. So I think at this point, that's all I had to cover and sort of demonstrate. So I'll hand back to Caroline and welcome any questions.
Thanks, everybody. That was super. So now's the chance if anyone would like to enter any questions, then they can add them into the Q&A. And then the team hopefully will try to answer your questions for you. Ella, maybe this is while people are thinking about that, you show data completeness, and that's obviously the first thing that people in trust should do to act. How can you improve your data completeness?
So the first is to have the dashboards and see where sort of improvements are needed. And then I think it's working with, there are local leads within the NDRS, and I think that will be the first port of call, is to reach out to them.
And I can see, Vicky, I'm going to drop you in it because I can see you there and you're always so helpful. Have you had any experience of trying to do that? Would you be able to, oh, you're on mute. Oh, I can't. We probably have to turn you off mute. I don't know if I can easily do that. I probably can. Give me a second.
Not room enough.
Yep, I can hear you.
Can you hear me?
Yes.
Oh, phew, it didn't look like it was coming off. Yes, so we're literally just doing this now with our local cancer team, but we're working with the MDT coordinators because a lot of this information is documented within the MDTs. So actually, if we can make sure it's captured, then entered into we use Infoflex, where I am, entered into Infoflex and obviously uploaded to COSD. That's our best way of trying to improve the data that we're entering, because although you're using it for the NATCAN audits and we're picking up on the data completeness for the NATCAN, those teams should be putting it in anyway into COSD. So we're working locally in that way, and hopefully we'll start to see some of the other audit and effectiveness teams taking that same approach.
Lovely, thank you. Right, I will look at my Q&A. Okay, I'll start at the beginning. There's one about sharing the links. Yes, we can share links. Thank you. And I have a question. Yes, good question about outliers. Will outliers be named for the 6 new audits and also for the other audits that have now moved under NATCAN? Sorry if you covered this early in the meeting. I don't think we have, so it's a good chance to talk about outliers because it's something coming for the future. So, Joe, that's probably one for you.
Yeah, that's fine. Yeah, you're right. We didn't mention it. So that is definitely something that we will be working on our outlier process. But for the first year, our first State of the Nation reports for the 6 new audits will just obviously be a bit of a baseline. So we won't be following an outlier process for this year for the 6 new audits, but it'll be something we'll be looking at subsequent years. Some of the other existing audits are looking at that. So the prostate audit carried out more of a sort of informal outlier process this year. And the lung audit is actually looking at doing something called early signal reporting, which will be sort of reporting unusual performance, either better or worse for certain indicators. But that, again, will be more of a sort of informal process. But that's still sort of in the works at the moment. So we don't have anything really concrete to share about that for now, but we're hoping to introduce that with our quarterly reporting later on in the year in the lung audit.
That's great. Thank you. So, right, here we go. Next question. Well, this question about the timing. So, have you thought about staggering the publication of so many reports in September? They are different clinical teams. It's the same governance team and approval routes, which will cause a bottleneck. Thank you. Yeah, I mean, I can say something about this. I think we're going to. Well, the first thing I suppose I'm going to say is that let's see how September goes. But it came from a different place. It came from a place of really having a focus as having September as the cancer data month. That's not to say that everybody needs to immediately act in September. It's that is the month to expect all the new audits and all the data. But these are good questions, and I don't know if any of NatCan team want to sort of comment on that, or whether it's worth going through the first cycle of reporting and seeing how we go on that. Joe, is that one for you?
Maybe one for Julie, actually.
Oh yes, Julie, you're there too.
Julie,
yes, sorry, I didn't see you there. Julie's the operations director of the centre. Hi, Julie.
Hi, Caroline. So I think we will. Obviously, we've got agreed deliverables within our contract for these audits as well, and so at the moment our time frame is sort of set in stone for reporting. But I think, like everything, it's iterative, and we'll keep it under review. I mean, you can imagine our end. Our teams, like I think Ella, Amanda, and Joe have demonstrated, they work across the team members to work across 2 audits. So there's a lot of resource. It's a really resource intensive our end too. But I think it's where there's a need, isn't there, within the system? And I think there's pros and cons, isn't there, to having all the reports reporting at the same time or staggered. So I think we just keep it under review. But for now, I would say the next couple of years, that's the situation. And in fact, next year, prostate, OG, and bowel will move into the reporting time frame for the 6 new audits in NatCan. So next September, 9 of the cancer audits will actually publish their State of the Nation reports at the same time. So that's a real shift.
Yeah, it's probably really worth. Perhaps we can cover a question I was going to ask, which is that these different reports and outputs have different audiences, and those State of the Nation reports, while coming at the same time with the accompanying data, that looks very different from the quarterly reports, which are obviously, I mean, they're all the same month, but they're staggered throughout the year, and people can pick those up at the time. And my question, perhaps to you, Julie or Joe, is just a little bit more detail, if you could, on if you're in a trust, how to nicely switch between looking at that State of the Nation data and then the quarterly data, and how they should complement each other, please.
Yeah. Do you want me to take that, Joe? So I think that, like, the State of the Nation reports, they very much have a snapshot it's, it gives the national picture at a particular period in time. The beauty of the quarterly reports is we can look at changes over time. They're changing from one month to another, as I think Ella demonstrated quite nicely with the dashboard for the lung cancer audit. So there are differences. I think there's also differences about the quarterly reports, because they are updated every quarter. They will be able, in a kind of that kind of close sort of shorten the lag between, which has always been a concern, hasn't it, about the audits, shorten the lag between data submission and reporting. And so I think the quarterly reports very much there. Our desire, our aim is to support ongoing local quality improvement. So it's not just a 1-year snapshot. So I think that's the differences. I think there's also differences in the data sets that are used. So for some of the cancer audits, unlike the lung cancer audit, it's appropriate to use gold standard data for the State of the Nation reports, simply because of the breadth and depth of data that's available. So a good example is a prostate cancer audit, for example, where key metrics in prostate cancer patients need to be risk adjusted. So you need Gleason, you need PSA, you need TNM staging. Gleason isn't available at present in the rapid data. The only source of that is the gold standard data, and there's quite a long lag for that being available. So for those metrics, they're reported on an annual basis in the State of the Nation report. So there are nuances from one audit to another as well. So it enables us to sort of work around that nuance. But hopefully the teams will provide, and they do provide, sort of explanatory information that goes alongside the State of the Nation reports and the quarterly reports to help people to understand what's the same, what's different.
Thank you. That's really helpful for me. I hope people found that helpful. I mean, there's a lot, isn't there? There's a lot coming up, but hopefully we will get into a regular cycle. People know what to expect and when and how to use it. So that's really helpful. Right, the next question is, are we aware of any plans to include more cancer audits in the near future? I have to say I'm not, but that's not to say that there aren't any plans. And I suppose the normal process is for funders to think about where there's a need, what other activities are in place, where particular topics lend themselves to audits, where there's data, and so those are the sort of questions that are usually considered. I don't know anything more about that at the moment. And then I have another comment. Oh yes, okay. No, this is a good question to NATCAN. So when we've tried to look at whether when we've tried to look at whether our data used in national audits is present and correct, we've really struggled to understand where the data has come from and which databases. Please can you provide much more detailed information about where each piece of data is drawn from? And there is some information, isn't there, in the introductory tabs. Jo, Amanda, I don't know if you want to say any more about that.
Sure. At least for the new audits in the quarterly report and in the Excel document, it does list where which data source we've used and which variable was used for each data quality indicator. Maybe something that is the translation is because I think trusts enter into cause D. What we receive tends to be, amongst other data sources, the more curated registration data. So it's not necessarily, let's say, a one-to-one match, but we do try to highlight, which variables we've used, which data set, and that's good feedback, and we can probably endeavor to provide more information on kind of the really underlying variables from COSD. And also to note that each audit has produced a key COSD data items list for each audit. It's on the website. Again, we can send links after this. That is kind of our list of the most important variables from COSD for each audit. Perhaps help focus any attention on those ones.
Thank you. Then you've got a comment from Sam Watton. Hi, Sam. Oh, this is about the MVR. I don't know if you've seen that. One of your colleagues actually in the RCS, I believe. The MVR will probably be the next one to produce the dashboard. We welcome any feedback on layouts, etc., which I'm sure you can provide. there's a question here, Belinda. If that example, oh, this is the Gleason, isn't it? If that example in gold standard, not of, if trusts use the Cambridge risk matrix, for example, which contains Gleason, would that overcome the issue? Yeah, we, Julie, you know about this, don't you? Because that you did look into that in the past, didn't you? Oh, you're on mute, Julie.
So this is the Cambridge prognostic where there's sort of 5 groups rather than 5 risk groupings rather than 3 risk groupings. We still need Gleason to be able to generate that. So you'd need gold standard at present to do that, which is almost 2 years out of date.
And then the next point is, yes, this is always an interesting point for the audits about patients being seen by different trusts along their journeys, I think. So we have patients who have a diagnostic test in a neighbouring trust, but all referrals, other tests and treatment are with our trust. Will those patients be allocated to our neighbouring trust where the histological diagnosis was made and not us? This may potentially skew numbers. So each audit does provide information on exactly this topic. Julie, are you able to say a little bit more about that, please?
Yeah, so we use the cancer registry data item trust at diagnosis. So I think that could be where it's where the sort of histological diagnosis, as you imagined, and I think I'd probably refer you to NGRS data dictionary to find out precise information about that. But I think it depends which indicators we're reporting. So within the audit, so a lot of process measures around diagnosis, for example, they will be reported at the level of trust at diagnosis. But for audit, so when we're presenting outcome measures, so say outcome measures following receipt of radiotherapy, outcome measures following, so maybe complications following radiotherapy or complications following surgery, we use we would report those at the level where the procedure was carried out or the patient received their treatment as appropriate for that particular indicator.
Thank you. I don't have any more questions and we are nearing the end of our time. So I hope everyone found that useful. And thank you to all our presenters. They're very busy at the moment, writing quite a lot of reports and producing quite a lot of data. So thank you for presenting. I would like to remind you that Clinical Audit Awareness Week continues tomorrow. There's 2 more live events tomorrow. There are a number of resources all available on the HQIP website, and we will be working with NQICAN tomorrow lunchtime for lunch and learn, and then there's an event tomorrow afternoon with Stella Vig from NHS England. So there's a live event with her tomorrow afternoon. So please do look at our website for details of those events. And I think that's all I need to say, unless oh yes, Lacey has just sent the link. So with that, thank you very much, and I will close.
Thank you.